Good. All right. Well, I am just going to welcome everybody and let you know that we will start in a little bit, but we're just waiting for everybody to log in. This is the Radon Information Session, so we are glad that you have joined us, and we'll get started in a little bit. Right, so I'm just going to do a little bit of orientation and then I'll get Shane to give us an introduction. But we are on Zoom, and so we can't see or hear you. It's in webinar mode, but you can interact with us through the chats. And so we will go through that in a little bit once we get started. But it's good to have you join us, and I will hand it off to Shane.
Perfect. And hi, everyone. So first, I'd like to thank the Take Action on Radon team for joining us and doing this program for us. So we did this program in 2024, late 2024. So we had a great turnout for that. So we wanted to bring this back. It's a growing issue, and we've seen some good positive feedback from everyone and wanted to bring this back. So I'd like to introduce my colleagues here who are working with us. So we have Pam here from Take Action on Radon. We have Stephen Thorne, who's a CNRPP professional. The audience, we have Dr. Anne Marie Nicol is a colleague there from Simon Fraser University. So they're going to be doing a presentation just to help inform people a little bit more about this. And I'll be talking with you at the end of it as well, just to for any residents who want to come in and receive their test kit. So I'd like to send it back, and yeah.
Sounds good. Thanks so much, Shane. And yeah, we're really glad to be able to work together with the community. As Shane said, we've done this before, and so it's really great to be able to do it again. So we're going to do a half-hour presentation. It is meant to be interactive. So if you have questions, please feel free to put them in on the chat. We will pause and then start answering the questions at the half hour. And then, as Shane mentioned, we've got Stephen Thorne, who's a local mitigation professional, so he can help with answering any of those detailed questions that you have about what happens after you test and if you have high levels. So feel free to put those in any time, but we will go through our presentation first and then answer those at the end. This program is the first time we run it with the community, it's free. And then the next time we try and provide it at our costs. So there is a $30 cost for you, and we will explain all those details with Shane at the end. But if you have questions, again, feel free just to put those into the chat. And I'm going to hand it off to Dr. Anne-Marie Nicol to get us started about the basics of radon. Anne-Marie, can you see my screen okay?
I can. And I'll just say next, please.
Okay.
So my name is Anne Marie. I'm trained as an epidemiologist in the area of cancer prevention. And when I first started my work 25, 30 years ago, I'd never heard of radon. And at Health Canada or StatsCan, every few years, some people get that as extra questions on the census and they ask people, what is radon? And still less than half of Canadians have even heard of radon. So if you don't really know much about it, you're actually not alone. You're in good company because, like the majority of Canadians are still wondering what radon is. And it's pretty hard to reduce your exposure to a cancer-causing substance if you don't know how you're exposed to it or what it is. So that's a big part of this program is talking to people about what radon is, its health effects, how to test for it and fix it. And then that's part of why we are here, because we help we connect people to tests so that they can test your home, because that's the only way that you're going to know if radon is in your home. And I'll explain a bit more about why that is. But just to say, we're also a national project. So I'm calling in from the far west coast of British Columbia today. And if I suddenly disappear, it's because my power has gone out. So I'm on a small island and it's very windy and we are very vulnerable to the internet getting knocked out. So I apologize if I suddenly disappear, and Pam will be able to pick up on that. But we do encompass all the traditional territories of the many First Nations, Métis, and Inuit people whose ancestral footsteps and rights extend beyond the colonial boundaries we exist today. And we respectfully honor these people's rights, histories, and relationship with the land. Next, please, Pam. So inhaling radon gas is the leading cause of cancer, lung cancer, in people who don't smoke. And again, this is one of those facts that most Canadians don't know. So after this presentation, you are going to be able to ace that census. If you ever get the Household and Environment Survey, you're going to be able to say radon gas causes lung cancer. And even in people that smoke, it's actually the second leading cause of lung cancer for smokers. And not all smokers get lung cancer. They often get other conditions like COPD, but there's something about the co-exposure of particularly the PM 2.5 from the smoke with radon, and that's still being investigated, the nuts and bolts of it, but there's synergistically much greater risk, and I'll show you that in a minute. So if you're a non-smoker, it's the leading cause of lung cancer in Canada. And if you smoke, it's going to contribute to the likelihood that you will develop lung cancer. Next, please. So radon is designated as a known human carcinogen. And that means that organizations all over the world, including the WHO and IARC, which is an organization in France, all agree that people need to be living with lower levels of radon, because over time, if you continue to breathe it in, you can develop lung cancer. So unlike things like carbon monoxide, it's not immediately dangerous to life and health. It's chronic exposure, but that's why we want to keep those levels lower, because over time, the damage from the radiation, and radon is part of the radioactive decay of uranium. And that's why it's such a big deal in Canada, because we have a lot of uranium in the soils across the country. We're one of the leading producers still of uranium mining. But even if there isn't a uranium mine in your region, there likely is some demonstrable amount of uranium in the soil. And over time, it breaks down, and radon is the one gas phase. So it means that it can move. So that radiation is then mobile in the soil, and it can move from the ground up into people's homes. So in Health Canada has done some back of the envelope calculations, and they essentially estimate that about 3,000 people, over 3,000 people, die from radon-related lung cancer every year. And if you're not familiar with lung cancer, just to say that it is the leading cause of cancer death. We've done great strides for prostate and breast cancer, but lung cancer and then colorectal cancer are the two cancers that Canadians die from. And so anything that we can do to reduce exposures that lead to lung cancer, it's not a very treatable cancer, and it's not a very survivable cancer. So that's part of why we're here, is this lung cancer prevention work. Next, please. So radon and smoking don't mix, as I mentioned earlier, and Health Canada has put out some publications to just try to illustrate how much more significant the risk is if you already are a smoker, or even if you've recently quit smoking. Some of that damage remains in your lungs. So if you have high radon, your risk of developing lung cancer is still pretty high. It's 1 in 20. But if you smoke and have radon, it's 1 in 3. So in fancy terms, this is called a submultiplicative relationship, but it just means that there is significantly more impact if you already are a smoker. And we know that it's hard to quit smoking. So if people are taking steps to improve their lung health, it's actually easy to test for radon, and then relatively straightforward to fix and reduce those exposures if you do have radon in your house. So if you're considering not smoking anymore, this is another great thing that you can do to reduce the chance of getting lung cancer. Next, please. In BC, we have a program where we try to quantify again this relationship between radon gas exposure, lung cancer, and smoking. So in Canada, down the bottom of this table, it says 200 in red and then 600. So we use becquerels per meters cubed to measure radon gas exposure. So 200 is the guideline in Canada, but it's not actually a safe level. If you have 199, it doesn't mean, yay, it's a get out of jail free card. This is what's called a linear dose response relationship. So there is some risk even at low levels, but under 100, your lifetime increased risk of getting cancer is 1% lung cancer. So that's not very high. But you can see that it starts to creep up between 1 to 200 becquerels. And that's why if you go to Europe, they recommend In some cases that it's 100 is the WHO recommended guideline. The US, they use about 150. They use a different measurement metric, of course, because they have to be different, but ours is 200. And so you can see at 200, it basically doubles the relative risk. So it's 2% increase for non-smokers. And then if you smoke, it's 17% higher. And then if it's 600 and higher, and I'd like to say that there aren't many places that are over 600 becquerels, but that is not true in Canada. We have parts of BC where people have homes in the 2,000 and 3,000. So it's not necessarily uncommon to have these higher levels. And you can see that's a significantly higher impact if you are a smoker or not even. So how do you get exposed from this uranium byproduct that's sitting in the soil? Again, radon is a gas, so it likes to move from cold, dense places to open, warmer spaces, and that means it migrates through fissures and cracks in the soil and around rocks up into homes and or buildings or any place that basically has a roof and walls and windows. It gets inside through cracks in floors or walls or around drain pipes. Some people have sump pumps or other entries from the foundation or cracks in the side walls. And levels are generally thus higher in the basement or in ground contact rooms, but that can vary depending on how you heat your house. Next, please. So where is radon mostly a concern? Well, as I said, pretty much any space that's connected to the ground and closed in. So that's homes, especially if you spend a lot of time in your basement or ground floor. People often have finished basements with home offices or entertainment areas or gyms. Schools, so classrooms that are on ground contact floors. And then, yeah, really any other office building. In many provinces, workplaces have been tested. So places where people might have sustained contact. And we usually recommend people test in areas where there's 4 or more hours a day spent in that room is a good place to test. Because again, it's not the 5 minutes that you spent going downstairs to get jam out of your basement if you don't spend a lot of time down there. But if you have a finished rec room in a basement and you spend time watching TV or stuff, that's when you'd want to test. Next, please. And then, so how do you test for radon? So it's a colorless, odorless, tasteless radioactive gas. So there's no way that you can guess what the level is in your house. You have to have a test device to help you test. And that's part of what this program is we provide people free tests. Here in BC, if you wanted to buy one of the tests that you're going to get, it would cost about $60. I think it's other provinces have varying levels, but I think ours are some of the cheapest. That's called an alpha track detector. So in this case, you leave it in your house for 3 months. Pam will tell you a bit more about this. And then you mail it back and you get a test result that's emailed to you. But there's other kinds of detectors. There's what's called a digital monitor. So it provides either an output on a screen or you can have it set up and it'll talk to your phone. And some you can buy those online, but they usually start at about $150 and go up. Some places have them for lending in the libraries. We've set up programs across Canada for people if they'd like to take them out of the library. They are not as accurate though as the test that you're getting. So that's part of the reason we use these detectors is because they're easy to use and they're quite accurate and they're kind of indestructible too. And then an important thing to realize is it's gases vary in concentration depending on how hot or cold things are, and just general patterns in the soil. And even the weather can influence radon gas levels. Low and high pressure ridges can influence how much soil gas moves in and out. So we need to measure for a while to make sure that we haven't erroneously got a very high level or a very low level. So what we want to know is what your average is. And we don't want to know where the worst part of radon is in your house. So some people have crawl spaces and it's likelier that the levels would be high in the crawl space. But unless you spend 4 hours a day or more in your crawl space, we don't recommend that you put the device there. We want to know on average what you are breathing. So the device should breathe the air that you are breathing. And so don't put it next to a window where it's open a lot because you're probably not hanging out the window. And then again, don't try to find the worst place in your house because that's just not realistic. So the detectors that we use are alpha track devices. And as I said, they are reliable, but they are a one-time use, but they are the most accurate kind. So you put it in your house, and again, Pam will explain a bit more, for the 3-month period. You send it back to wherever you got it from, and then it's sent to a lab to be read, and the results are sent to you. It is relatively indestructible. It's okay if it falls off the edge of something. It's just plastic. The device does not require batteries. You don't have to turn it on. It just passively breathes the air that you breathe, and it has a little device inside that tracks how much radiation passes through. Sometimes kids play with them. That's fine. They are not inherently dangerous, nor are they radioactive. They are simply just a piece of plastic. But they are a particular kind of piece of plastic, and they have been quality assured. And so Pam will explain how we continue to do that to make sure that they are of the highest standard, and they are certified by Health Canada. And I think I'm passing it over to you, Pam, unless there's any questions
Sounds
about
good.
health in the chat that you wanted
I
me to.
think there will be,
Okay.
but yeah, I think we'll jump in those at the end here. Yeah.
Okay.
Good. Yeah, thanks, Anne Marie. So as she mentioned, it's a long-term risk, and the levels can change. And so we test for radon using a 91-day test or longer. And so Health Canada then, once you test and the report test goes back to the lab, it gets analyzed, and then you will get a report from the test. And on the report, we'll have the average of the radon level in your home. As Anne Marie mentioned, it will be in becquerels per meter cube. That's how we measure radon. And Health Canada recommends that if you are above 200, that you take action to reduce it within the year. And so I will go through a little bit about mitigation. As I mentioned, we've got Steve on to go through more detailed, but I'll just kind of skim through a high level. So just to give you an idea of what to do if you do have levels above that 200. And we have a national certification program in Canada. So CNRPP is the program we have worked with Health Canada to develop. We have standards and professionals that sign off on a code of ethics, and then also an accountability program for them. And so you can go on the CNRPP website and find a list of professionals if you do for mitigation, and then also for measurement. And then there's also just some general information on that website, and so you can check it out. Now, if levels are high, the most effective way to reduce them is a radon mitigation system. And this includes a pipe and a fan that provides a pathway for the gas to come from beneath the house up and out. So as Anne-Marie mentioned, radon comes from uranium, and uranium is in the soil all across our country. Uranium breaks down. Uranium itself is a solid, but when it breaks down, it eventually turns into radon, which is a gas. And so it moves up out of the air and can be found in our homes. And so the mitigation system provides a pathway for the gas, so radon and really any other soil gases that are coming up from beneath your home, so that instead of coming into your home, they go up through this pipe system and out, where they get discharged into the outside airs to quite low levels. And so it's simple, a concept, and simple to maintain, but it is important that it gets installed properly. You want to make sure that the fan is properly sized for your home. You want to make sure that the foundation is well sealed, so it's not drawing conditioned air down, or that it's not an ineffective system. And so it is important to make sure that it's properly installed. So as I mentioned, hiring a certified professional and then making sure it's installed to our standards. Here's a couple pictures just so you can visualize what it might look like. It can get installed in an out-of-the-way place. The professional will go in and test to make sure that it's effective, and it actually is going to draw air from the full foundation. And the idea with radon mitigation is you want to reduce levels to as low as possible. If you don't have a concrete foundation, it can be installed with a crawl space. So here's some idea of a crawl space mitigation. It would be properly sealed with a membrane, and then the pipe and fan can be installed. The pipe can be installed through the membrane, again, with the fan attached as well. And then all openings really should be sealed. So there is a photo of a sump pit here, but really any openings in that foundation should be sealed. So there is also measures in the National Building Code. So in Newfoundland, this applies regionally. but it is currently just a rough-in pipe. So if your home has been built, in accordance to the current National Building Code, it may have these things included, which is a granular layer under the slab and a poly liner, and then it may have just a short pipe, which is a rough-in. And so this doesn't fix the problem, it doesn't reduce the levels as is, but it's there so that if you do test, that you can mitigate and finish off the system. So you can extend this pipe out, add the fan, and finish it. Now, there's been a bit of news about the changing building code, and so this pipe has been now addressed in the National Building Code so that it would be extended all the way out to the exterior of the building. It hasn't actually been adopted, so although it's been published in the 2025 code, it still takes time for regions to adopt it, but that's sort of the next step of what we know is coming. The other thing is there is a national grant program. So if you do test for radon and levels are above 200 and you need to mitigate, then you can find information about the grant on the Canadian Lung Association website. I put the link there, or you can just Google the Lungs Matter Radon Grant with the Canadian Lung Association. It is income-based, so they do have the information on their website about the income levels. And then you do need to apply before getting any work done. So you need the test report, but then you'd apply after that. All right, so that's a little bit of the background. We've gone through the kind of the health aspects, a little bit quickly about testing and then mitigation. And so now I'm going to go into details about actually testing. So once you get your detector, then you can what do you do with it? Okay, so as we mentioned, you can go and pick up detectors starting tomorrow, and Shane's going to go into those details in a little bit. Once you get the detector home, it will be in an envelope, so you can open up the envelope, and inside is a clear package with this little black detector in it. And you can cut open the clear package, take it out, and set it up. There are instructions in the kit as well to help you with setting up, but I will walk through and just explain where in your home you can put it. On the detector is a serial number, and we need that serial number to connect it to your information so that we know where your detector is located and who to send the report to. And so when you set it up, then we want you to go and log in. Just go to the website, or you can scan the QR code, and you just need to record your contact information along with the serial number and the date that you started. There's some mandatory questions, and then there's some optional questions. So we are doing a little bit of research. So if you want to keep going, you can complete those optional questions. But if you just want to give us our mandatory information, no problem. And then you can just stop after that. And then you're going to leave it in place. We talk about 100 days because ideally we want to get that minimum 91 days. And then you can leave it in place until the collection week, and then you can drop it off at the collection week because the detectors do need to return to the lab for analysis. Okay, so once you get the detector, as I mentioned, you're going to set it up in your home. So I want you to think about your house. Think about the lowest level. So if you have a basement, think about the basement. If you don't have a basement, think about your main floor. And is there a room in that level where you spend 4 hours a day or more? So if you have a basement, but you don't use it much, then you want to think about your main floor. But think about a room where you would be 4 hours a day or more. So maybe a home office, a bedroom, a family room, something like that. And once you've picked their room, then think of a location within that room where it is on a shelf or a table, roughly in the zone of the air that you're breathing. And a location that can stay for the 3 months. And so you want it up off the ground, and you want it about 1 meter away from the window or more. And you also want this location so that it stays for the 3 months. So as Anne-Marie said, there's nothing toxic. It's not going to hurt children or pets. But if you do have children or pets at home and they might play with it, you might want to set it up a little bit higher just so that it stays around for that 3 months. So you can pick a location on a higher shelf, or you can even hang it on an inside wall, or hang it down from the ceiling just so it sticks around for that 3 months. So here's some examples of where you could put it. You can check out the instructions. The instructions do give some detailed measurements, but we try and just give you some simplified idea of where to put it. Keep it up off the floor, keep it away from the window, and put it on a shelf in the breathing zone. Okay, and then as I mentioned, you're going to set it up and then record the start date. So this is what the page might look like when you go to record the start date. And then there's mandatory information. So your contact information, email, address, and start date and serial number is what we require for the radon report. And so we'll get you to complete that right away. And then that's it. That's all you need to do for the 3 months. Now, Anne-Marie mentioned that these are accurate detectors, and we do know that because we do quality control on them. And so one of the things that we do is we provide duplicates to about 10% of the detectors. So 10 of you will receive 2 detectors in your envelope. And so we just ask that you would treat those the same. So just open them up at the same time, put them side by side. Just treat them like you've got one detector, but put them together. And then at the end, we look at those results and make sure that our detectors are measuring accurately. So we know that they're measuring accurately because we have done this for 7 or 8 years now, and we keep testing it, but we keep testing them to make sure so that we have any indication if there's any issues. So we just ask that you put those side by side. Okay, so that's the setup process. And then after the 3 months or the 100 days, on your envelope, there is a collection week. And so you can pick up the detectors from the Town of Torbay office, and then you're going to drop them off during that collection week to the same location. So when you go to drop it off, you just need to drop it in a box. You don't need to worry about putting it in anything. But you do need to complete the end survey. So again, we just need the serial number and the end date so that we know how long you had it in your home. And then once the town collects them, we'll provide a shipping slip, and they're going to send them back to the lab. The lab will analyze the detectors and then provide you a report by email. So this is what the report will look like. It'll have some information that you provided with your address, information on it. It'll have the start and the end dates as well on it. And then it'll have a number for your radon report. And this will give you a number of what your average radon level was in your home while that detector was sitting in your home. Now, you will get on the envelope is a bit of a checklist. It has the serial number on the brown envelope as well as a place to put your start and your end date. And so if you keep that envelope so if you drop off the detector without any information, without any bag or envelope, and you keep the envelope, that has the information on it that you would need if you don't get this report. So for some reason, the email doesn't go through and you don't get it and you can't remember, what the serial number is, and we're trying to connect you with the report. That envelope will have the details on it that you need to help us with connecting you with the report. So you can keep that envelope until you get this report. Okay, and then I saw in the chat already a couple of the questions were about, when we did this before, how many detectors did we distribute in the community? And so at the end of this project, we do a report. So we do a summary report. And so we've done that for a number of communities across Newfoundland. And so this was the last report that we did with Torbay. So we had about 53 homes and about 11% were above the guideline level. We would really love to get that up to be over 100 at least. So this year, when we produce a report, we'll update this report. And so to keep track of both years of data. But you can see that we've also updated our, these are a couple from this past year from some communities that are around. Oh, I covered that up a little bit, but this one was 11% in St. John's. So we'll produce that at the end of this program. Now, the other thing that we do is we will send you emails to remind you about the different steps. So after you get the detector and you take it home, we will send you an email to remind you to start it. We trust that that's going to be the first thing that you do after you go home with it, but we also know that you're human and that you might forget. So we will send you a couple reminders. But we do find that our emails go to spam. So if you either send us a quick email just saying hi, that you're part of the program, you can email us at info@takeactiononradon.ca. That will kind of get us into your email system so that your email will accept emails from us. Or you can manually go and add our email address to your safe senders, and that will help us with getting the emails through. So we'll send you an email to remind to start, and then at the collection period, we'll also send you an email to remind you that the collection period is coming up. All right. So I am going to pause it there, and we're going to talk about the picking up the detector. Yeah, and there's lots of questions. So Shane, starting tomorrow, people can go in to pick up the detector. Do you want to give us some instructions for that?
Yeah, of course. Yeah. So yeah, starting tomorrow, people will be able to come in and pick up the detector. So we want people to pick it up before February 16th. So there's a bit of time. Also want to point out that as of now, there's still, from what I see, there seems to be less than 40 test kits still available. So I'll put the link here in the chat there. So if you want to share that with your friends, family, neighbors, anyone, just to inform them and let them know that there's still some devices left and that they can join this. That'd be amazing. So just a bit of information for when you come in to pick up your device. So I am in the planning and development department. So that's where you're going to pick up the device. As we said before, it's $30 for it. You'll actually need to go, just so everyone's aware, you can come in through the front door and you can pay for it first. You'd have to go upstairs to our corporate services department to pay using their debit machine, and you'll be able to come downstairs and pick up your test kit there. And we'll be available. We'll have the front desk there available to help you out with any questions you might have. Yeah, so that again, you'll have till February 16th to pick that up, and I believe there's the 91 days minimum you'll need to keep that. So yeah, I believe that should be all on my end. And again, you can call in to the town if you'd like to, if you have any other further questions. Yeah, so you can call at 437-6532 at the town, and we'll be able to answer any more questions that you might have. And yeah, should be good.
Perfect. Yeah. And the hours are Monday to Friday, 8:30 to 4. And so we will also email this out to those that have pre-registered. And so as Shane said, we have just over 60 that have been registered or that have kind of registered to join. So you might have just registered for this information session, but not necessarily chosen a test kit yet, but we do have one for you. So we put you on a list just in case you decide you want to pick one up. But there are still more available. So tell your friends and family that they can go in and pick that up. All right, we are going to now go through some of these questions.
I have some questions, Pam. So some of them have been answered about where the how and how many people had tested. So I think that. So Jacqueline asked, how does different heating sources affect radon levels in a home?
Yeah, that's a good question. So we have done research on this, and so I'll talk about it from a research perspective, and then Steve, maybe I'll bring you in case you have some more local perspective on this. But what we found is in a home that has central air. So forced air heat, the air is circulated throughout the house and the levels can actually be quite even throughout. So even if you have a 2-story home, the levels may be fairly even on each floor. In a home that has a radiated type heat, it can be layered. So the radon gas is coming in from the basement. So the highest level in that situation would be in the basement. But it doesn't just mean the basement is the only place that levels are high. It can still be high throughout the home. It's just like a little bit layered. So at a percentage, maybe 80%, 80 to 60% in the main floor, and then maybe 50% on the next floor up. So that's how it can. Steve, do you have anything to add specifically?
Yeah, we see the same as what you're describing in terms of the levels on each floor. But what we also notice is that lots of times the ductwork is not designed well. And just the fact that your system is running can create a large negative pressure in your basement. It's actually sucking the radon into the home, and then it's distributing it all through the home. We also see the same thing with HRVs when they're not installed properly or when they're not maintained properly. They can also contribute heavily to the radon levels in your home.
Yeah, that's a really good point. So that opens up a little bit of the expertise of why hiring somebody is really important because you know some of those other additional factors that to look at regionally. So we talked about the fact that the radon mitigation system is pretty easy and simple concept. But Steve, do you want to just explain if you go into somebody's house, what's kind of the process throughout? Maybe start with how long at a time that you're typically in a home and kind of a general process, what it looks like when you go in.
Sure. Well, the first thing we do is we come to your home and we do a formal walkthrough, and we'll ask. We have a whole checklist of questions and things we want to look for. Sometimes there's some simple things that we can adjust in your home or fix or patch and try to lower the levels that way. And we also provide of course a written estimate if you do need a full mitigation system. So we try to make sure that you truly need a mitigation system before we come in and install one. So that's the first step. Secondly, if we determine that you do in fact need a mitigation system and you wish to proceed, we're going to find a good location in your basement, assuming you have a basement, and we're going to drill a 5-inch hole through there. Don't picture jackhammers and dust going everywhere. It's all done with proper dust collection systems and all that kind of stuff. We install a test fan in that hole, and we're going to run a series of experiments. And what we want to see is when we create suction in one part of your home, we want to make sure that we're getting that suction everywhere underneath the slab. And if we can get really good pressures that way, then we know that system is going to be really effective. Ultimately, what you end up with is this hole in your floor with a piece of pipe in it, that's sealed, of course, and then a fan, and then that pipe extends outside, usually through the side of the home, and that's where the radon is going to exhaust.
Yeah, great.
Did I miss anything, Pam?
No, I think that sounds pretty good. All right, Anne Marie, we got some more questions.
Yeah, we do. So, someone mentioned the fact that there isn't a lot of soil around Torbay. So that's Psy, and they're curious about radon and soil depths. And so just to be clear, radon actually comes from rocks and soil. Of course, soil has more surface area around it than rocks do, just per cubic feet because it's smaller. But rocks and soils can emit radon. It's not just soil. So if you're on bedrock, it can also be an issue as well.
Yeah, this is a common question. People try to predict how much radon is going to be because of the soil type, and it's all across our country in all sorts of types. So,
It's true.
yeah.
And then Steve commented that he's seen houses in Newfoundland as high as 6,500 becquerel. So that is quite high. But the highest he's seen in Torbay is 1,400. So yeah, that's sort of on par with what we see in the Okanagan. And New Brunswick also is a province that has some very high levels as well. And I think we've covered all of the questions that are in the chat that I can see so far, unless anyone has any other questions that they wanted to ask at this point in time.
I noticed a couple more about water supply.
Oh, the water supply, yes.
Yeah,
Yeah.
and so that's an interesting question. So I'm assuming Torbay is on a municipal water supply, is that right?
We have a part of our community on the municipal water supply. There's a good number of houses still on well water, so
Okay.
there's a mix of both.
Yeah, okay. So for those homes that are on a municipal water supply, that there could be radon in the water, but that radon gets aerated as or released as the water gets aerated. So as the water moves through the municipal water supply, typically it gets a little bit of agitation and aerated prior to it entering any of the homes. So usually by the time it gets to your house, the levels are low. For those that are unwell, it's possible that not as much agitation happens prior to it entering your home. And so there could be, if there were radon levels in or radon in the water, then it could be aerated while you're using it in your home. For example, in your dishwasher or clothes washer, it agitates and moves the water around, and so it can actually reduce or release the radon. Now, the key concern with radon is inhalation. So it's when you breathe it in. So the first thing to do is just to test the radon in the air. So exactly the tests that we're doing, you would just test the air and see what the radon levels are in your home. And then we would mitigate, because what we have found is if the radon is coming from the water, the primary source is from the soil gases, because it's coming from the gas from the soil first. So that would be mitigated. You test again to see if the levels are still high, and then you might start to do some problem solving on testing the water. Testing the water is a little bit more complicated, but that's kind of the process that we would start with. Steve, you want to jump in and add some for that?
Yeah, radon in water is a very real thing. I haven't seen it yet in Newfoundland, where significant amounts of radon in the home is coming from the water supply. And we have a lot of very deep artesian wells. I'm sure at some point I'm going to see it, but certainly haven't seen it yet.
Yeah, and if there was an interest, we could do some research, because we haven't really found a lot of high levels across the country. There's one region in Quebec, in
Chelsea.
the western, Chelsea, Quebec, which is close to the Ottawa area. But that's really all that we've seen so far. But we could do some research and see what we found if there's some wells that are interested. The other part of that question was the building code, which I was going to just check in with Shane and Steve. I know Newfoundland, it's regional. So do you know if many builders in Torbay are building to the 2020 building code?
I want to say probably yes and no, probably a bit of both. From everything we see where people are getting the permits to build, it seems like they are building it to code, but there are still obviously older homes that may not have been to that. But as of new builds, I believe everything should be built up to the code.
Jane, am I right that Torbay does not have a municipal inspector? Is that correct?
That's correct, yeah.
Yeah. So what we generally find in homes that don't have inspectors is that the majority of the build is built to the National Building Code. The first piece that gets missed when they're not inspected is the radon pipe. Every time. So, St. John's, Mount Pearl, Paradise, CBS, the radon pipe will be in there, the rough-in pipe. What we typically find outside those municipalities is that the rough-in pipe gets missed, gets lost in the shuffle. So if you're building a new house, please insist that your builder puts in that rough-in pipe.
Yeah, and we do have a page. One of the questions was about links. So I was going to put a couple of the links in the chat, and I can send those out in the email as well. One of the links I shared was about the lungs grant, mitigation grant. So I put that in the chat. We do also have information for builders that we can share. So I can certainly share that out as well. And I'll put that in the chat.
We have a new question from Michelle.
Yeah.
About houses, are they typically higher in the winter? So generally, they are, because we call that a closed home, because your doors and windows are shut, although not everybody closes their doors and windows. But we also looked at people who keep their houses closed in the summer for air conditioning purposes. So was some research in the US that showed that some houses have higher levels in the summer, because that's when in the warmer places, because that's when they keep their houses sealed up. But in Canada, we recommend people test in the winter, because that gives us sort of a realistic understanding of what it's like when most of your doors and windows are closed.
Yeah. And and it can draw in more during the winter too. It can
Right.
be, yeah.
Here's a question, Pam, about, sorry, Lisa, your question. So they have 2 bedrooms in the basement, with 2 kids. How
Yeah.
do they choose which bedroom, and does it matter?
Yeah, I saw that question. I was intrigued by that one because I've actually had that quite a few times as I've been talking to people on the phone. Which one do we choose? Yeah, it's a good choice, either one. A bedroom is a great location to choose because that's where you probably spend a lot of time. I also had this on call where the husband slept in one bedroom, the wife slept in another bedroom, both in the basement. I was like, I'm not going to choose for you.
Yeah.
But either one is a good choice. Most likely, if you've got one heating zone, it's probably going to be fairly similar in both bedrooms. So take the stress off, and maybe pick the one that the detector is most likely to stick around for 3 months. I don't know if that's helpful, but yeah, I don't. You could flip a coin. Yeah, I can't choose for you, but either is a good choice.
I think that's a good point too. Like if it ends up in a, sorry, my internet's glitching a bit. If it ends up in a toy box or someone's played with it or someone played hockey with it, just pick it up and put it back where it was. It's not the end of the world. If it Pam has done research on whether, I mean, don't put it in a drawer for the whole time, but if it does move around a little bit, that's not the end of the world. You can just put it back to where you had it to begin with.
Yeah, yeah. And like Emery said, we did research where we put detectors all over a room. And I did this because I've spent lots of time with people calling me saying, okay, I'm standing in my house and where do I put this detector? So we were like, how much does this really matter? And it's actually very even within a room. So, we give you guidance, keep it up off the floor, keep it away from the window, put it in a location where it'll stay for the 3 months. Those are the 3 pieces of information. As Emery said, it's not dangerous. So if kids move it and play with it, it's not going to hurt them. Also, pets, it's not going to be toxic to pets, but we have had a few that have been chewed up by the dog. If the detector gets punctured, it's no longer useful, so we can't read it anymore. Or if it gets broken. So they are pretty rigorous and they have fallen and behind, couches and tables and whatever, and still measured fairly accurately. But in the winter, we did have somebody drop it on the ground and it broke. And so it's not indestructible, but it's pretty good. All right. So yeah, I put the Lungs Matter grant in the chat, and I think that's all kind of the links that we shared. And then Shane put, I think, in the chat that if someone else would like a detector, so there are more that people can register for. So we'll keep that open. Any other questions? Feel free to put them in. Steve, I'm just going to throw it to you. Is there anything else that you think we typically make sure people know about that we haven't talked about yet today?
There's one question from Jana. We live in Torbay and plan to pick up a kit, but might have friends and family living in other communities. How do they get access to a kit? For example, St. John's.
Yeah, good question.
I know where I would send them. Where would you send them?
Yeah, so I will say first, we are encouraging people in the community to snap these up. So we anticipate that all the ones that are available for Torbay will get snapped up. If you'd like to purchase one, you can go on to the Take Action on Radon website, and we have a list of providers. So you can click on your province and find who sells them in the province to find a list. Is that good, Steve? Anywhere else?
Transferradon.ca.
There you go. Yeah. Okay. Yeah. You can also check out Steve's website because he's a local provider and sells them locally. Good.
So to your question, are there other things that I can think of that normally get asked? I think for this region, Torbay is about typical, about 10% of the homes. We do see some higher levels, a little bit higher Mount Pearl, and definitely CBS area is quite high with about one in 3 homes in CBS above the 200 limit. That's kind of the one typical question that I get that I can think of that might cover. I think Pasadena is probably now the new radon king for Newfoundland,
In
at about
Newfoundland, yeah.
50% of the homes are high.
Yeah.
Matthew just asked a question about spray foam. Steve, I think this is probably a you question. If he's having spray foam done in March in the basement, will that affect the test?
Well, I think maybe you and I can answer this one, Dr. Nickel. So spray foam in the basement is going to air seal the basement walls, and you are going to turn your house more into a little bit of a chimney. So it could increase the levels.
Mhm.
The VOCs that come off from spray foam when it's applied, uh, for an alpha track detector, I would assume that have zero impact on that detector. I can't think of any other real impacts. The I would say if you're spray foaming the walls, the cold joint where the concrete wall and the concrete slab meet, make sure that gets sealed either with the spray foam or some other caulking before you fully develop out your walls. That that cold joint is brutal, and if it doesn't get sealed up and you have high levels and we have to come in and mitigate and that's leaking, it means we have to tear your walls apart to get in there. Usually just pull the baseboards off, get in there without tearing up the finished wall apart. But it's a lot of work. So if you have the walls open and you can seal that up, seal up any other openings in the slab, plumbing penetrations are one, cleanouts are another, and the where the interior load-bearing walls are, those are also very leaky. And if you have the opportunity to seal those up now, please take the opportunity to do that.
And possibly under the furnace?
I don't see that here.
No,
So
okay.
what Pam's referring to is sometimes they'll install the furnace first, or the heat pump in our case first, um, before they pour the concrete slab. And I haven't seen that here. What I have seen is they'll put the electrical backboard in first. So they'll get the electrical panel on and they start wiring the home. And then they'll pour the concrete, and that leaves a huge hole, uh, just a highway for radon to come in behind that electrical backboard, because the concrete doesn't get in around there. So that's one thing I've seen in a fairly new home, but I haven't seen anybody install a heat pump and then or around it here yet, thankfully.
Yeah, okay. So yeah, I would test as normal. It is possible that your levels could change. They could go down, they could go up after you've spray foamed. So we would recommend that you test again after that. But it'll give you a good idea of a pre and post test. So yeah. There was another question that I think we missed.
How often do we need to test?
Yeah, so that's another good question. The guidance is if you make any renovations, so anything, any just energy efficiency measures or any major renovations, you should test again. We have been advocating for testing every 5 years, so that's sort of starting to come in some of Health Canada's guidance, but levels could change, especially if you're kind of above 100 in that guidance level. One of the other questions we typically get is about other measures that other buildings that have been tested. So Anne-Marie talked about homes, but also schools, workplaces should be tested. And we do know in Newfoundland that they have tested all the schools and they have been working through mitigation. So that's a really good sign. And yeah, I know there was one more, so I'll quickly look through it. But Shane, while I'm doing that, I'll maybe just throw the slide up again about the location. There was another question which may have come in before we talked about it, but where people can get their kits from.
Yeah, of course. Yeah. Just to remind everyone again. So you can be able to pick up your test kit starting tomorrow, and then you'll have until February 16th to pick it up. So you can come to the town hall. And again, so you'll have to pay for them in the upstairs part at the corporate services department. So you can go upstairs first to pay for that, pay $30 for that. And then we'll be holding them downstairs in the planning and development department. So once you pay those, you can come downstairs and receive that. So again, we'll be there open Monday to Friday from 8:30 to 4. And our address is there, 1288 Torbay Road. again, just want to point out that there's still some devices, so spread the word to your friends. And as you answer the question before, even if your friends or family are in uh, different communities, different municipalities, they'll still always have a chance to get those devices through this program and through you guys. So yeah, just always spread the word, and hopefully we can get in Torbay that 100 houses that you're hoping to get for us. So let's try to get that during this year's program.
Yeah, sounds good. Oh, I read the question that I was asking. Somebody asked about, are there levels different in Torbay? Which Steve talked about different regions of the province, and we're seeing different percentage of homes. But what we typically find, so when we do a community survey, we do kind of map it, but we see that there are homes next to each other, that one will be high and one will be low. So it really, we can't predict where in, a map the radon levels are going to be. They don't typically pocket in just one area. They can be anywhere in the community. So if your neighbor has tested and they were low, we still recommend you test. If your neighbor tested and they were high, it doesn't mean you're going to be high. So every house should be tested. And then I did also see, a question about the cost of mitigation. And so we have done a bit of research to see that the costs are typically between $3,000 and $5,000 across the country. So nationally, that's what we're seeing. The cost depends on the complexity of a home. So a home with a large crawl space or maybe complicated architecture might be a little bit more. I don't know. Is that reasonable, Steve? You want to add to that?
I think we're able to fix 80% of the houses for 3,000 or less. So I think we're coming in a little bit less than the national average. The only other thing I'll add to the Torbay stats is, but 1 in 10 are high, but in Torbay, the ones that are high seem to be really high. 400 plus is kind of what I'm seeing. In most communities, we'll see kind of a lot kind of right at the 200 mark. But in Torbay's case, they seem when they're high, they tend to be, quite high.
Yeah. Okay. Good. Oh yeah, the last question was about the dates. So I put the date February 6th on the slide because we're sort of trying to encourage people to pick things up quickly and get it started. But as Shane said, they are available up until the 16th while supplies last. So go in and pick them up if you can within the next week, but they will make sure that they're available until the 16th. That'll be kind of the last cutoff. So that's the discrepancy on our dates. Shane is giving you good time. I'm trying to account for your humanness that you probably will put it off to the last minute. So I'm trying to help you not, but that's the difference. All right, so that is the hour. Thank you very much for all that have joined us. We really appreciate for those that joined us online. And if you're watching this recording, thanks for doing that as well. Our contact information is on the envelope and the instructions, so feel free to reach out if you have questions. And Shane mentioned you can also reach out to the Town of Torbay office as well. Shane, thank you so much for hosting this program and helping us connect with the citizens, local citizens. We really appreciate that.
Of course, and thank you guys so much. So Pam, Steve, and I think Anne Marie had to leave a little bit early, but thank you guys so much for doing this for us. And to all the residents here coming to pick up a kit, thank you as well for joining this program. And we really look forward to seeing how this goes this year. Thank you so much.
Yeah, that's great. All right. Have a good night.
See ya.
You still there?
I need Aaron to end it. So